Hi there. One of the cancers that gets missed or misdiagnosed the most is colon cancer. Colon cancer has very specific signs and symptoms that show up: a huge weight loss, a lack of appetite, but also bleeding, obviously, from the rectum or the anus. Those are very obvious signs that something is happening within the colon. It is extremely important that a doctor or a nurse, whoever sees these signs, to check for colon cancer. And it is such an easy test for this particular type of cancer to look for. It's either a colonoscopy, and nowadays they have at-home tests that you can send in your fecal matter back to a lab, and they will test and see whether or not you have any type of colon cancer cells there. It's also a very easily treatable disease. Taking out portions of the colon is sometimes the only thing that needs to happen. Of course, radiation and chemotherapy might still be required, but at the end of the day, it's something that is not only preventable, but also very treatable. However, colon cancer does get missed, and it gets missed for various reasons, whether somebody might be losing weight and they don't think any, and the doctors don't think anything of it, or if there is anal bleeding and it is something that the doctor dismisses as lack of fiber or hemorrhoids. That is obviously negligence and malpractice and needs to be discovered a little bit more thoroughly. If you or a loved one had suffered from colon cancer and you believe that your doctor should have caught it and should have diagnosed you with it so that you could get treatment earlier, then you may have a medical malpractice claim. And it's important for you to speak to a medical malpractice lawyer about that. My name is Adam Funk, and I am a medical malpractice lawyer, and I'd be happy to chat with you about your potential claim.